Hey, it's me again. In this video, we're going to talk about another example of evaluation. Again, evaluation is analyzing the data to come up with a reason why something is the way it is. It's the technology of solving problems. I think it's one of the biggest things that's missing in healthcare, and it's the most valuable thing because if you don't have a good evaluator, you solve the wrong problem, you treat the symptom, which just makes the problem persist, or camouflages the problem. So let's just take a look at this 59-year-old female. She works swing shift, can't sleep, craves sweets, neck stiff, not satisfied after meals, pre-diabetic, allergies, sleep apnea. She bloats, constipation, indigestion, acid reflux. Low tolerance to stress, low vitamin D level, weak legs. When she climbs or does incline, ulcer, she had a history of an ulcer, excessive thinking, analyzing. So this is a very, it just jumps right out. She has a lot of adrenal symptoms. So right there, we're going to write adrenal. So let's just take a look at if they all relate to adrenal or if not. Now, working swing shift is going to totally disrupt her sleep cycles. Our bodies are not designed to rotate the sleeping. They're designed to help you help you sleep or make you go to sleep when it gets dark out and wake up when it gets light. So if you're working against gravity, that can really throw off your internal clock. So over years of working at night, it's going to throw you off your circadian rhythms, which allow you to get in sleep. So that could be what created the stress on the adrenal. I'm not sure. Sweet cravings. The hormone, one of the hormones that the adrenal gland makes is called cortisol. Another name for cortisol, which is the stress hormone, is glucocorticoids. Gluco meaning sweet, it's because it regulates blood sugars. So, a lot of diabetics are diabetics because of the adrenal overacting. But this could be adrenal, and then look at, she's a pre-diabetic, so we know that's adrenal. Other symptoms are adrenal would be stiffness and inflammation because all of the anti-inflammatories are controlled by the adrenals. Think about what they give you for pain. They inject you with a steroid shot. What's a steroid? Prednisone. Those are anti-inflammatories. That's adrenal hormones. Also, allergies are adrenal because some of the treatments involve EpiPens, that's epinephrine, that's adrenaline. Well, why would that fix an allergy? Because there's something related with allergies to adrenal. If you take the adrenal glands out of dogs in different experiments, they all end up with allergies. So why wouldn't we just take that and use that and try to improve the adrenal to see if we can improve the allergies? And a lot of allergies occur after years of stress as well. But there's other causes. Sleep apnea. That is really not a sleep problem. It's a sinus swelling in the back of the nasopharyngeal area behind the palate back there. There's a nerve that controls that, and it comes out of the brainstem, and it's the 10th cranial nerve, and that can be influenced by high levels of adrenal stress. So bingo, right there. That's adrenal too. Not satisfied after meals. One thing that this would be is a gallbladder problem, but think about it. The gallbladder is influenced when you have high stress. That will shut down the bile recycling of bile on the gallbladder and give you these symptoms right here. Okay, so even though this could be a low bile, if we look deeper, it could be an adrenal issue because the adrenal could cause that. Again, we're trying to pull a string and see how far we can go back. Indigestion. That is really low stomach acids. That's low acid in the stomach. And again, one of the characteristic things of adrenal do relate to that in a way that you have alkalosis. So when your body is too alkaline, what can cause it is high level of adrenal hormones, cortisol. There's this huge myth going around that everyone is too acid. Well, maybe their urine is, but I'm talking about the blood. If that blood becomes excessively too alkaline, and you can read this in the physiology books on the adrenal, high cortisol. I'm not just coming up with this for no reason. And your body's too alkaline, a lot of things will happen. You'll get indigestion. You won't be able to transport minerals. That's why you'll get cramps in your legs. You'll have breathing problems at night. You'll crave salt at night. And allergies, just from being alkaline. And that's why some of the remedies back in the 30s for allergies was to take something called ammonium chloride. Ammonium chloride is an acidifier that they used to use as a binder in allergy medications, and they took it out. That was the active ingredient. So ammonium chloride is not a harmful thing. You can take it and to acidify your pH and rid allergies. One of the ways you know you're excessively too alkaline is if you consume like citrus, orange or grapefruit or even lemon, an hour later you will have pain in your joints. That would be a good indicator of alkalinity. You're too alkaline. You can't really tell by your urine or saliva if your blood is too alkaline. And the problem, if you take the blood out of the blood vessel and test the pH, it gets exposed to oxygen so fast, it's very difficult to test for an alkaline blood. You have to really use these other indicators. But citrus oxidizes, it breaks down, and it goes very, very alkaline. So when you drink any type of citrus, it's actually, even though it's a citric acid, it turns into an alkaline substance, worsening this state right here. And the point I'm making is I'm just trying to give you the background of what can happen with adrenal, with your pH, and how that can relate to this as well. And even oxygen. All right, so now we have, that can explain indigestion because you're going to have you're going to lose your stomach acids in the, as well. And then acid reflux is really, that's caused by not enough acid, because if you don't have enough acid, you won't be able to close that valve that separates your stomach from your esophagus, and because you need a really strong acid, and if that's not there, you'll get acid reflux. So really acid reflux is not enough acid, and the way to fix it is to take an acid, not to take an antacid. So if you take an acid like betaine hydrochloride, that will help that. But the fact is that this is one of the symptoms of adrenal, too, not just, not enough acid. So if we go deeper, I think most of these symptoms that this person has is adrenal, right down the list. So that's the most likely thing that we're going to support. Low tolerance to stress, that's adrenal. Low vitamin D, that's adrenal symptom. Weak legs climbing, that's definitely adrenal because it affects the lower extremities. Ulcer, that's a symptom of adrenal. Excessive thinking, adrenal. So it's classic adrenal. So I'm going to go with that and see if she gets better. If she supports adrenal and it doesn't work, then we have to relook at things. But I like to go with the most likely logical thing that makes common sense. I'll see you in the next video.